We are back. This is Dr. Arthur Perry. This is What's Your Wrinkle right here on WABC. Tonight we're going to be talking about vascular anomalies. Oh my goodness, it sounds like something right out of the X-Files. We just heard that music. We've got Dr. Naiem Nassiri. He is one of only a handful of doctors in the country with what we call an integrated background, both in vascular surgery, that's surgery on the arteries and veins, and endovascular interventions. Those are the brand new things in surgery. This guy has published many scientific papers in journals and textbooks, and I am so happy to have him on the line. Dr. Nassiri, are you here?
Yes, I am.
All right. Well, thanks so much for taking time on your Saturday evening. Now, tell us something. What is the story? There's this Vascular Anomalies and Malformations Program at Robert Wood Johnson that you're the director of. Tell us what this is.
This is basically a very highly specialized, truly multidisciplinary group of physicians and ancillary staff that I was able to put together to really tackle this comprehensive problem of vascular anomalies, which encompasses a really wide clinical spectrum, which can range from lesions of cosmetic concerns to actually life and limb-threatening conditions. It really.
So now.
Yeah.
Yeah, go right ahead. Continue.
Yeah, they really can affect anyone. It's not solely limited to the pediatric population. Oftentimes, these lesions actually don't become manifest until later on in life, particularly during the periods of pubescence, for example, or during pregnancy, or when some sort of a trauma triggers the onset of the symptomatology. And a lot of these lesions are actually quiescent. In other words, we don't really notice them. They're asymptomatic until some sort of an environmental trigger manifests their symptomatology.
So now there are all sorts of different abnormalities of the blood vessels, and that's what we're talking about here. Things like arteriovenous malformations. There are irregular connections between the arteries and the veins of the body. There are lymph connections that are abnormal. And then there are these things called hemangiomas, correct? What's the difference between a hemangioma, that a lot of people call all these things, and an arteriovenous malformation?
That's an excellent question, and thank you for bringing that up. Hemangioma is one of those terms that is very often used haphazardly and sometimes erroneously applied to any kind of a vascular lesion. A true hemangioma, now there are many subtypes of hemangiomas, but a true hemangioma is actually a benign tumor of the lining of the inside of the blood vessels, as opposed to a vascular malformation, which you mentioned several different kinds. There's actually not a tumor process going on with these. These are merely errors in the development of the blood vessel. So there's a vastly different pathogenesis, or the process by which disease develops, that separates these two processes. And it's of utmost importance for us to be able to differentiate and distinguish between these two broad categories so that we can provide the correct type of treatment for the patient. So nomenclature, or the terminology we use to identify and diagnose these lesions, is of utmost and primary importance.
So now, one of the vascular malformations that a lot of people see, but they don't know they're vascular malformations, are those red, what they call birthmarks on people's faces. And you can get those in the scalp, on the face. They can cause all sorts of problems, overgrowth of the skin, big lips, big nose, the skin gets very big. It's part of a syndrome. Now, how would you, as the director of your center, treat something like that?
So it really depends on the extent of the lesion and what part of the body is involved. If you're referring to the classic port wine stain, which many people have, this port wine stain is actually nothing more than a simple venous malformation, but a venous malformation affecting the smallest, tiniest venules, which are these little blood vessels that actually drain blood from our organs and take it back to the heart. Depending on the depth of the lesion, the treatment for it is vastly different. We have many different tools within our armamentarium by which we can tackle these lesions. The most common type of vascular malformation by far are these venous malformations. If it's something that's very superficial, oftentimes laser therapy can be of significant help to us in terms of both the cosmesis and also the progression of these lesions. Sometimes even these tiny, very superficial lesions can cause significant chronic inflammation, swelling of the local skin, which is not only unsightly but can also become uncomfortable as well. And some of the more deeper lesions actually can be tackled with really minimally invasive techniques that really take very good advantage of the imaging modalities that we have available to us, which includes fluoroscopy, which is plain X-ray, contrast enhancement under fluoroscopy and X-ray, as well as ultrasound and MRI.
Well, our time is running short, but this is a really fascinating subject, and one that I'm sure so many of our listeners have connections to, either themselves or a relative that has something like this. The Vascular and Anomalies Malformations Program is at the Robert Wood Johnson University Hospital in New Brunswick, New Jersey. We've had Dr. Naiem Nassiri, who is the director of the program. Now, if you want more information about this program, you can call Robert Wood Johnson. It's 888-MD-RWJUH, 888-MD-RWJUH. There's a website, rwjuh.edu, and you can get all sorts of information about this program. Dr. Naiem Nassiri, the director of the program, thanks so much for taking time on this Saturday evening. I'm Dr. Arthur Perry. You've been listening to What's Your Wrinkle? Right here on WABC, where we are every Saturday evening, unless there's a football game, of course, every Saturday evening, right here, 6 o'clock. So tune in again next week. By the way, the Dr. Oz Show, maybe next week. I'm not sure if I'm on it, but hopefully coming up this week, maybe the week after, I'll let you know. It's Dr. Arthur Perry. We'll see you all next week.